Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Amantadine. Its brand name is Symmetrel. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Amantadine. We'll then touch on examples of dosing and finish it off with side effects with percentages. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Amantadine interferes with the function of viral M2 protein's transmembrane domain. This prevents the release of infectious nucleic acids from viruses into host cells. In terms of indications or reasons we would prescribe this medication to a patient, well, we may see Amantadine prescribed in the treatment of Parkinson's disease, as well as Parkinsonism. This medication may be used to treat influenza due to influenza A virus. Amantadine may be used to treat medication-induced movement disorders, so extrapyramidal disease, as well as drug-induced dyskinesia in patients receiving levodopa. With respect to contraindications or reasons we would not be able to prescribe Amantadine, well, first of all, we just wouldn't give this medication to a patient who had a hypersensitivity to Amantadine or to any other component of the formulation. Lastly here, if a patient had end-stage renal disease or a creatinine clearance less than 15 mL per min, they would also not use this medication. Now for some examples of dosing with Amantadine. So in the treatment of Parkinson's disease, using the extended release formulation, we would see an initial dose of 129 milligrams orally once daily in the morning. The patient would then have the option to increase in weekly intervals to a maximum of 322 milligrams per day, again given in the morning or taken in the morning. The patient was using Amantadine for drug-induced dyskinesia in patients with levodopa. Again, using the extended release formulation, we would see an initial dose of 137 milligrams orally once daily at bedtime for 1 week, and then we would increase to the usual dose of 274 milligrams once daily at bedtime. As with all medications, there are some side effects or adverse reactions that patients may experience while using Amantadine, so we'll go over some of those here now. 1 to 13% of patients may experience orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position. 1 to 16% may experience peripheral edema. Constipation may happen 1 to 13% of the time, and loss of appetite comes in at 1 to 6%. Nausea happens to 5 to 10% of patients, and xerostomia or dry mouth happens between 1 and 16% of the time. 3% of patients may experience abnormal gait, and dizziness may occur in 5 to 16% of patients. Insomnia comes in at 5% to 10%, and agitation at 1 to 5%. Anxiety may happen up to 7% of the time, and 1 to 6% of patients may experience depression. Some patients may experience a dream disorder, nervousness, and up to 21% may experience hallucinations. Some patients may experience falls as well. The more serious side effects would be congestive heart failure, leukopenia, or suicidal intent. Alright everybody, that's all we're going to talk about today with Amantadine or Symmetrel. As always, I'm very thankful you took the time to come by and watch one of my videos. If you find the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.